Good afternoon, everyone. We will begin today's conference in just a minute. We're going to wait for the telephones to keep ringing and bring in more veterans into our Town Hall conference today. We're very excited to have you on. We're going to be going over a lot of great events and information for today's conference. Again, as a reminder, we're waiting for telephone calls to go out and get veterans joining our conference, and then we will begin shortly in roughly about a minute. Got a lot of phone calls going out. Very excited to see people picking up the phone and joining today's event. So far, we got about 100 veterans on the line. That's excellent. We're going to see that number continue to grow. We're about a third of the way through the phone call. So again, just hang tight as we get through this. All right. As a side note, as we continue to wait for the phones to ring, some exciting news. We did stock our fishing pond today. I was there just before that. Some wonderful perch, bass, and some catfish, along with some flathead minnows for some snacks for those fish. We did have some veterans out there to enjoy that event. And for veterans, all you have to do is press 1 to get connected to crisis services. While the prior crisis line phone number is still active, we are encouraging all those to use the simple 988 number to access the crisis services. When you're in that event, it can be very hard to remember a full phone number. That is why we have shortened it to just 3 digits, 988, and then press 1 to get expedited for veteran resources. Encourage everyone to place that number in your phone today. You may need it for yourself or a friend or another, so a great resource to have. To get the most current updates from the Toma VA by signing up for our email updates, you can go to www.va.gov/toma-health-care. Scroll to the bottom of the page and subscribe to our Toma Healthcare news and announcements. You'll get our newsletter, press releases, and other communication products as we release them. And as always, we encourage you to like our Facebook page where we routinely provide national and local updates about what's happening on our campus, including events just like this, our Veterans Teletown Hall. This month, we have been celebrating Women's History Month by honoring our Native American women veterans throughout the month with highlighted stories on our Facebook page. Very inspirational. Encourage you guys all to check those out. We also have Women's Veterans Town Hall and a luncheon coming up on March 27th from 12 o'clock noon to 1 o'clock p.m. And on March 29th, we would like to invite everyone to attend our Vietnam Veterans Day event to honor our Vietnam veterans with a pinning ceremony in Veterans Hall at East Campus Street, Toma VA, starting at 9:30 in the morning. Watch our social media and website for more information to come. We will begin our town hall shortly. All right. Good afternoon and welcome to the Toma VA's live Teletown Hall. My name is Dr. Brian Prawl and I am your Associate Medical Center Director. And today I'll be your moderator for this afternoon's call. We are fortunate to have presenters from Toma VA's leadership team as well as other subject matter experts to provide program updates to you, our veterans. This includes Ms. Karen Long, our Medical Center Director, Dr. Mary Ellis, our Chief of Staff, Ms. Molly Ritter, our Nurse Executive. We also have Ms. Samantha Hartshorn, our Eligibility and Enrollment Supervisor, Dr. Mary Clark, our Associate Chief of Staff for Medicine Service, Dwayne Honeycutt, our Veterans Benefit Administrative Partner, our Vision 12 Deputy Chief Medical Officer, Dr. Calgatti, Mr. Trevor Johnson, our Community Care Nurse Manager, Mr. Todd Harrelson, our Nurse Clinic Manager for Wausau and Owens County CBOC, and Ms. Christy Clark, our Public Affairs Officer. We also have subject matter experts from Whole Health, Benny Travel, and other partners from within our medical center to answer your questions for today. We hope you stay on the line with us, and I encourage you to participate in the question and answer sessions that will follow. If you would like to ask a question, simply press 0 on your phone, and you'll be connected to an operator. This gets you into a queue for an opportunity to ask your question. You can begin to call in with questions now. We will begin to answer questions after the announcements have been made. If you decide to end the call, unfortunately, there's not an option to rejoin, so please stay on the line if you were to participate in today's Teletown Hall. Let's start the Teletown Hall with a message from our Medical Center Director, Ms. Karen Long.
Hey, thanks, Dr. Prawl, and thanks to all of you for joining the call today. So just real briefly, a little bit about the agenda for today. We're going to provide an update on neurology compensation and pension exams. Then we'll also share some new information regarding the expansion of healthcare eligibility under the PACT Act. After that, we will have an update on the newly remodeled urgent care clinic on the Tomah campus. Very beautiful space for veterans to enjoy. Then we'll hear more from the community care, as well as getting highlights of the services provided at the Wausau Community-Based Outpatient Clinic. And then finally, we'll discuss veterans' access to phone services. And so throughout the call, we'll have some polling questions that you'll also be able to answer. And so I just do want to start off by talking a little bit about the neurology comp and pen exams. These were exams that were conducted previously at the Tomah VA. And the Veterans Benefit Administration, also known as VBA, conducted reviews of these previous exams at the Tomah VA Medical Center. And they've been actively reaching out to veterans who they believe are eligible who are eligible for a comp and pen reexamination and may be eligible for equitable relief as well. Veterans who are eligible for this reexamination should have received a letter in the mail the week of December 4th, 2023 from VBA with directions on next steps. And this piece is really important. If you receive that letter, you have 1 year from the date of that letter to reach out to VBA to request a reexamination. So after those letters were mailed, the VBA National Call Center also reached out to veterans via phone 1 week after those letters were sent out. So if you're a veteran and have questions on your eligibility status from a previous neurology comp and pen exam that was conducted here at the Tomah VA, you're welcome to contact VBA, and that number is 1-800-872-1000, and again, that number is 1-800-872-1000. And I want to thank all of the nation's veterans for choosing VA. And if any veterans have any other concerns related to their health care, please reach out to our patient advocates, as they're always available, and they can be reached at 608-372-3971, and that extension is 66353. And again, patient advocates, 608-372-3971, and the extension is 66353. Thank you.
Thank you, Ms. Long. And again, I think that was some great information, so I just want to reiterate that again. If veterans have questions regarding their eligibility status on the neurology comp and pen exams, VBA can be contacted at 1-800-872-1000. All right, we will now hear from enrollment eligibility with what's new regarding the PACT Act.
Thank you. My name is Sammy Hartshorn. I work in enrollment and eligibility, and I'll be informing you about the movement that will bring as many veterans as possible into our care through PACT Act. As of March 5th, 2024, our toxic exposure risk activity eligibility is giving us 3 new groups of veterans that are now eligible for VA health care, which includes veterans who were exposed to toxins or other hazards during military service times, veterans who were assigned to certain duty locations in Southwest Asia or parts of Africa, and veterans who deployed in support of certain operations after 9/11. What this means for our veterans: if you served time in Vietnam, the Gulf War, Iraq, or Afghanistan, you can enroll. If you deployed into any combat zone after 9/11, you can enroll too. If you deployed in support of the global war on terrorism, you can also enroll. If you have never deployed before but were exposed to toxins or hazards while training or during service on active duty here at home, by working with chemicals, pesticides, lead, asbestos, certain paints, nuclear weapons, x-rays, and more, you can enroll too. Bottom line, all veterans exposed to toxins and other hazards at home or abroad are eligible to enroll in VA healthcare. This is the biggest expansion of VA care in generations, and we want you to apply as soon as possible. It's quick and easy to enroll. You don't need to be sick or file a claim to be eligible. All you have to do is show that you served in one of those locations or operations, or participated in one of the activities that could have exposed you to toxins or hazards. Even if you don't think you need this care today, you might need it tomorrow, or the next day, or 30 years from now. All you have to do is enroll. Then you'll have access to life. So don't miss this opportunity. Better, more affordable health care is waiting for you. Go to va.gov/PACT and get it. I promise, we will do everything in our power to serve you as well as you have served us.
Thank you, Ms. Hartshorn. And again, what wonderful information. And just to recap that, right? The bottom line is all veterans exposed to toxin and other hazards, at home or abroad, are eligible to enroll in VA healthcare. And that is exactly what we're here to do for you, is take care of you. So let's start off with our very first polling question, which is, have you ever been exposed to toxins, hazards, been deployed to Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Afghanistan, Egypt, Syria, or Yemen, just to name a few? Or did you deploy in support of the global war on terrorism since 2011? And then the answers are 1 for yes or 2 for no. And as we wait for that to come in, we have several dozen veterans responding to the yes. So again, the point of this question, right, is that you are eligible for care to apply. So again, please reach out to our enrollment eligibility, and they will go over the eligibility piece of that with you. VA's goal with this is to expand those that we provide care to. For more information about the PACT Act, you can reach out to admissions at 608-372-1751, or you can reach out to your local county veteran service officer, or read all about it at va.gov/PACT. That's va.gov/PACT. All right, next we have Dr. Mary Clark, our Associate Chief of Medicine Service, who's going to be talking with us about our new urgent care.
Good afternoon. Thank you for your attendance today at our town hall. My name is Dr. Mary Clark, and I work in the medicine department. And I'm here to tell you about the Tomah VA Urgent Care Clinic. Last week, on March 11th, Tomah VA Medical Center opened a newly remodeled and expanded urgent care clinic. It's located at the front of Building 400, or right at the main entrance. Our hours of operation are 7 a.m. to 5 p.m., 7 days a week, including holidays. We have doubled our square footage up to 3,790 square feet, and there are 7 examination rooms. We do have special examination rooms for female veterans and for veterans needing special isolation precautions due to fever or cough. This is known as a negative pressure room. The Tomah Urgent Care Clinic is now a Level 3 designation due to a new VA directive which was released in March of last year. At a Level 3 urgent care clinic, you can expect the provider to be on duty during the hours of 7 a.m. to 5 p.m., 7 days a week. This provider could be a physician assistant, a nurse practitioner, or a medical doctor. At a Level 3 urgent care clinic, we can provide treatment for minor illnesses and injuries, such as ear pain, eye pain, sore throat, cough or flu symptoms, rashes without fevers, painful urination, or a minor cut that may need suturing. We also have an EKG machine on site. We will have X-ray staff and lab staff available, along with pharmacists for consultation. We will also have access during those hours to mental health providers. Just as a reminder, it is important to remember that whenever you're feeling you're having a medical emergency, you should dial 911.
Thank you, Dr. Clark. What great information. And if you haven't seen our new urgent care, Not that we want you to come there, but if you do end up using our urgent care services, they're wonderful, and I hope you really enjoy them. That is exactly what they're there for. So let's start with our second polling question. Do you know what medical conditions are appropriate to be seen in an urgent care clinic? Again, that's 1 for yes, 2 for no, or 3 for maybe. And again, the purpose of this question is we're trying to look at if we're doing a good job in giving out the message of what conditions we treat versus when you need to seek care at an emergency room. And by far, we have veterans responding with yes at about 70%. So again, when in doubt, again, we have the nurse triage line that you can call to get seen, or if you're feeling, medical emergency type symptoms, again, just dial 911. Otherwise, we have those wonderful urgent care services for you that Dr. Clark described. All right, let's move on to our third polling question. How do you like to receive information about our urgent care clinic? Would you prefer 1, a letter, 2, a postcard, 3, an email, or 4, a phone call? As we dial that in, again, use your keypad. That's 1 for letter, 2 for postcard, 3 for email, 4 for a phone call. And we are split right now between the letter and an email, with postcard coming up as third. So that's great information that helps us make sure that we're reaching out to you and the method that you prefer. For more information about urgent care hours of operation or situations appropriate for urgent care services versus an emergency room, please contact Medicine Service at 608-372-3971 at extension 61785. Again, that's extension 61785. Now we're going to shift to community care and hear from our wonderful Mr. Trevor Johnson.
Thank you, Dr. Prohl. Thanks for having me. So my name is Trevor Johnson. I'm the nurse manager for our community care department here in Tomah. And I'm also a veteran who I have had to use community care before I was in this position. The community care department at the Tomah VA consists of numerous staff, including clinical staff that are registered nurses, and administrative staff, which are medical support assistants in our call center, or our advanced medical support assistants who help process our authorizations, as well as program support assistants. We are all here as a team to help navigate you through the community care system and the process and help coordinate your care between the VA and the community. There's a few updates I'd like to share with you today regarding the Tomah VA Community Care Department. First, we do have an in-person walk-in office available to you to come if you would like to come in person to ask any questions. The walk-in office is located in building 408 on the second floor in room 2841, and it's open between 9 and 3:30, excluding holidays. As Dr. Clark just spoke about, we do have our wonderful newly remodeled urgent care site that's open between 7 to 5 p.m., 7 days a week, including holidays. If you choose to go to a community urgent care, we are asking you, please make sure that it's in network with the VA, that urgent care, and it's not a primary care walk-in clinic. You can find a list of in-network urgent cares local to you by going to www.va.gov, provider locator. Or you can also call to verify in-network eligibility by calling 1-844-MY-VA-311. Again, that phone number was 1-844-MY-VA-311. Upon presenting to the in-network facility, they will call a national hotline. It's 1-888-901-6609 to begin that process of utilizing your VA urgent care benefit. If you present to a community care emergency department, make sure that the facility is notifying VA ER notification line. It is that phone number for the ED notification line has to be notified within 72 hours of presenting to the ER, and that phone number is 1-844-724-7842. Again, I just want to repeat that. if you present to a community emergency department, the VA needs to be notified within 72 hours of presenting. And that notification can occur at 844-724-7842. One thing to keep in mind with all other specialty care and other primary care that you receive in the community has to be pre-authorized. You have to have an authorization prior to attending any appointments with a community care provider if you would like the VA to be the payer for those services. That also includes any referrals that you get from your current community providers. With that being said, if you do receive a bill in the mail, there is a process, a localized process we use for addressing billing concerns. So the first step we should take is you should review your authorization paperwork and make sure that the services you're receiving a bill for were pre-authorized by the VA in the time frame that your authorization was valid. If that checks out, you should be calling the community facility that's sending you the bill and ask to speak with their billing department. You can tell them you received the bill that should have been a VA authorization. You can give them the VA authorization number you received from your paperwork. If there is no resolution by contacting the community facility, you can also contact the VA National Billing Center. And that phone number is 1-877-881-7618. You can tell them you received a bill from a VA authorization and provide them with the authorization number and the dates of service, the facility where you received the care at, and the type of care that was received. And I would just say, as good practice, I would keep notes of who you're speaking with, what phone numbers you're calling, in order to relay that information to our national billing line. If, again, there is still no resolution and you are still receiving bills, please contact the Tomah VA Community Care Department. We will ask you the same information from step 2 and 3, and we can assist in helping you obtain resolution of that bill. We can understand and we can empathize with this process, and sometimes I'm throwing a lot of numbers out at you guys. If at any time you have any questions, you can always contact our call center, and we have this checklist that I just went over with you in a written form that we can mail out to you at any time. So thank you for the opportunity to provide the updates to you today, and thank you for your service.
Excellent. Great information, Trevor. And again, I just wanted to reiterate that this is an issue that I have as a citizen, going to in-network urgent cares, emergency rooms myself. So again, reiterating that you can go to www.va.gov to find in-network urgent cares. My recommendation is to do that ahead of time before you get sick, right? Because no one wants to look up that information when you don't feel well. That way you kind of got a good idea of what resources are in-network and available to you before you need to use them. And as he said, if you end up needing emergency room services, please make sure that they contact the facility and get that process going at 844-724-7842. Again, that's a tough thing when you need care and we have to get this done, but again, it's really important to make sure that your services are covered and provided. And as always, as Mr. Johnson said, if you have any questions, don't hesitate to give us a call here locally and we can help get you through that. So that brings us to polling question number 4. Do you know how to contact the Tomah VA Community Care Call Center? 1 for yes, 2 for no. Overwhelming responses coming in for yes, which is great. That's exactly what we want. We want you guys to know how to get the most out of your benefits. That is what they're there for. The Tomah VA is a community care call center available to you to call with any questions regarding your community care referrals. The call center is open Monday through Friday, 9 a.m. to 3:50 p.m. You can reach at 608-374-8182. Again, put that number in your phone at 608-374-8182. All right, we're going to shift our attention now to the Wausau Clinic with Mr. Todd Harrelson, our clinic manager there, to provide us some updates to our veterans in that catchment area.
Thank you, Dr. Prohl. As Dr. Prohl said, I'm Todd Harrelson. I'm the clinic manager for both the Wausau and Owen clinics. The Wausau Clinic is one of 4 clinics attached to the Toma VA. The reason we have outreach clinics in the VA is to bring services to the community. Veterans in the Wausau VA are cared for by 5 PAC teams, each consisting of a provider, RN, LPN, and an administrative person. The following are some of the services we provide. Primary care offers annual appointments to keep up with any changes in your health and make sure your medications are up to date. Annual appointments are available to see or talk with your provider about any recent issues that may need to be addressed. Pre-op appointments as well as women's health appointments are also available. We offer audiology. We have 2 full-time audiologists on staff to test your hearing along with a range of other diagnostic tests. If hearing aids are a good option for you, we will order, fit, and provide follow-up as needed. We have an optometrist to test your eyesight along with other diagnostic tests. If eyeglasses are needed, we're able to order, fit, and provide them as needed. We have a dentist and a dental technician that can provide crowns, bridges, fillings, and impressions for dentures if you qualify. We also have 2 physical therapists to meet our veterans' physical therapy needs. We have an on-site dietitian to aid in medical nutrition for veterans and their families using the nutrition care process. Our laboratory can be utilized before or after your appointments. Our lab is supported by Toma, Medicine, and Milwaukee, who result them and input them into your electronic medical record. A courier transport labs to the appropriate facilities daily. We have several mental health staff, including prescribers, therapy, and peer support, offering both face-to-face and video appointments. Primary Care Mental Health Integration, or PCMHI, is available for same-day mental health access. We offer many telehealth services. This can save you a trip to another facility as well as expedite your care within the specialty area. Some services offered through telehealth include cardiology, neurology, pulmonology, dermatology, mental health neurotesting, and many, many more. Our clinic also has 2 social workers available to help you navigate local services in your area as well as any VA services. Lastly, we have many whole health staff. Whole health is an area that has many specialties within it to provide helpful living modalities that may be helpful to you. One is health coaching to work on goals such as improving sleep, stress levels, mood, socialization, diet, and movement. Chiropractic care is a great way for fine-tuning the body. Acupuncture and battlefield acupuncture is useful for pain, anxiety, PTSD, and very effective for neuropathy. Guided imagery is an emotional technique for mindful meditation. Tai Chi can help you work on your balance and flexibility. And lastly, healing touch, which is moving the body's energy and unblocking stuck pathways.
Wow, thanks, Todd. That's a lot of great information. Just to recap, our Wausau Clinic, or in Rothschild, has primary care, audiology, optometry, dental, physical therapy, dietitians, laboratory, telehealth, social workers, and whole health. Wow. Tai Chi is a little bit beyond my reach. I have zero balance and flexibility, so I'm going to leave that one to the experts. With that, we'll roll on to our 5th polling question. Would you benefit from an in-person town hall with an expo on the services the VA provides? Again, that's an in-person town hall with an expo on services that we provide to veterans. 1 for yes, 2 for no, 3 for maybe. Again, the goal here is to look at, again, providing you guys the information that you need to better access your benefits. You earned them, we want you to use them, so that's exactly what we're looking for. We're about 50-50 between yes and a maybe, so that's good information. We'll take that and look into our next steps with it, so thank you so much. And with that, we'll move on to Ms. Christy Clark, our Public Affairs Officer, for some information on VA Health Connect.
Thank you, Dr. Prohl. I am Christy Clark, Public Affairs Officer at the Toma VA. I want to take a few minutes to give you information on the new initiative that greatly expands veterans' access to phone services that you have likely noticed when calling into our medical center or one of our community-based outpatient clinics. This new initiative is called the VA Health Connect. This new program enables veterans to access 3 core services 24 hours a day, 7 days a week. This is important as we have not been able to offer all of these services around the clock in the past. 24/7 services now include pharmacy service to refill and renew prescriptions, ask medication-related questions, receive medication education, and review treatment plans. Primary care scheduling and administrative support to help veterans make change or cancel appointments, relay a message to the Veterans Care Team, and receive additional information about VA services. Clinical triage, previously known as telephone care service or nurse advice line, to talk to a registered nurse and discuss new medical or mental health concerns and receive recommendations for healthcare needs. This may also include virtual visits with a VA Health Connect medical doctor by phone or video without having to come to the clinic. Last month alone, almost 1,000 veterans were able to get their needs met without ever having to step foot in a hospital or clinic. The VA Health Connect professionals can be reached by dialing your VA care facility and selecting option 1 for pharmacy, 2 for scheduling, or 3 for clinical triage. Please note, primary care scheduling is not currently available on holidays, but we will be adding mid-2024. All other services are now available on the holidays. Next time you call, you may notice a different voice answering from the centralized service. We know this may not be the person you are used to speaking to, but rest assured, the VA professionals you speak with have the same tools and training to assist you with your needs. You and your fellow veterans will continue to have access to the full range of in-person services at your local VA healthcare facilities. As a reminder, VA Health Connect services are not a substitute for emergency care. Veterans with medical or mental health emergencies should call 911. The Veterans Service crisis line at 988 or visit the nearest emergency room. We are also encouraged to use My Healthy Vet to connect your care providers directly in a prompt and efficient manner. You can learn more and register for My Healthy Vet by visiting www.myhealthy.va.gov. VA Health Connect veterans access to services with much greater flexibility and when you need them. If you have found us busy on Mondays, try us again another day or on off hours for faster service. We appreciate your patience and support as we continue to work on improvements to better serve you.
Thank you, Christy, and thank you to all of our presenters today. We will now open the lines up for questions. Again, if you have a question, all you have to do is press 0 to be connected to one of our operators, and they will get with you right away. Bear with me for a little bit. This is always a new and exciting way to get questions up as we use technology. So, okay, we have Don from New Lisbon on the line. Don, what's your question?
I have a question. I have been diagnosed with essential tremors. Can I get compensation for that?
It's a great question, Don. Mr. Honeycutt, are you on the line and you can assist with this question?
Yeah, hi. Can you guys hear me okay?
We sure can.
All right, great. Hey, Don, good to hear from you. Listen, I want to tell you that every claim is unique, almost as unique as a veteran's fingerprint. What I would like for you to do is give me some contact information, like your phone number, and I will have one of our reps here at the regional office reach out to you directly. Recently, with the PACT Act, they've added a whole lot of presumptive conditions and we'd like to have a private conversation with you to make sure we address all your concerns and answer your questions. So if you can give me a phone number, I'm prepared to copy.
I think we can probably provide you with the phone number, Dwayne. This is Karen.
That's perfect, Karen. I'll you can wrap it up in an email to me after, and I will have one of our reps contact him. If it's not today, tomorrow.
Perfect.
Great. Thanks so much, Don, for the question, and Mr. Honeycutt for the assistance on answering. Next question is from Bruce from Gleason. Bruce, what's your question today?
I've been through community care, been approved to go to to a different dentist than the one in Wausau at the VA clinic. I've been going to Quartz. Anyway, it's been about 2-3 months already. I've been told that I gotta get a cap or whatever you call that removed, and they need to put in a replacement tooth for it, which would hoping to get a dental implant. And according to the VA looking at it, it looks like I'm approved to get that, but we have not heard anything back, yes or no, from community care. So I'm just curious if they cover that or not.
Yeah, great question, Bruce. I'm going to turn this over to Trevor Johnson, our community care expert for today.
Hey there, Mr. Gertis. Thanks for taking the time to ask the question. Everyone's eligibility and treatment plan when it comes to dental is different. Dental eligibility and treatment plans are different than the medical benefit for community care. So what I'll do is I'm gonna grab your info, and I will have someone follow up from our dental team with you by the end of the week, okay? Because I don't want to discuss your case specifically on this large format here, but I will have someone from our dental team reach out by the end of the week to you.
Thank you much.
No problem. Thank you, Mr. Gertis.
All right, great question, and thanks, Trevor, for helping answer that. Our next question is from William from Tony, Wisconsin. William, what's your question for us today?
Yes, I've heard a lot about this PPH foam that they use for putting out fires on ships and various places. While I was on a ship in the 90s, we used it a lot, and a lot of exposure was made due to the fact that when you go into a hot spot, they spray you with it. Has there been any more results on this study through the VA?
It's a really good question. Mr. Honeycutt, are you able to assist with that question?
Yeah, hi, Tony. Glad to hear from you. So there is still research going on for exposure to the foam that you referred to. If you feel that you have been exposed or had toxic exposure to that foam, while it may not be used as a presumptive condition for exposure, certainly I would fully support you in filing a claim. Until that is passed into to law that exposure would be qualified, you could at least have set a potential entitlement date. So what I would highly suggest you to do is get in touch with either service organization, DAV, American Legion, VFW, or your county veteran service officer. Speak to them about what you feel your exposure was, and they will discuss this with you in detail. Probably, most likely, support you in filing a claim to get it of record. But as of today's date, there has been no legislation that would allow us to pay for, it's not just exposure to foam. It would have to be a condition secondary to exposure to that foam. I hope that makes sense to you.
All right. Thank you so much, Mr. Honeycutt, for helping to answer that question. Thanks, William, for asking it. That is exactly what we're here for. So we have a Mr. Sorby from Marshfield, Wisconsin. Mr. Sorby, what is your question for us today?
Yes, I'd like to know what we are entitled to as weekend warriors or the 6 years reserves that will call into the Cuban Missile Crisis? What benefits are we entitled to?
Excellent question. Mr. Honeycutt, you're popular today. Can you help us out with this one as well?
Yeah, I guess this should be a VBA town hall. Hey, good to hear from you. Good to hear from you. Hey, listen. So, when it's not just a simple answer to your question. First of all, we would have to establish the service, especially periods of active duty while you were in the reserve. So what I would suggest is give us some contact information. I know the TOMA personnel will provide it, and I will have some benefits entitlement person from our office reach out to you directly, get the details of your service, the time, and have a further detailed individual discussion with you.
Also, I have a second question. Why did they quit giving out diabetes shoes for diabetics?
That is a good question. We're going to have to follow up with you on the specifics of that. I don't have a prosthetics representative here today, but let me just write down that question because they report to me. It actually looks like we might have an answer here for you. Or no, sorry, we are just writing it down. Okay, good question. Stumped us on this one. So again, we will follow back up with you on that question. I got to ask my expert on that. We will move on to Mr. Blair in Rudolph, Wisconsin. Mr. Blair, do you have a question you want to ask us today?
Good afternoon. Can you guys hear me?
We can.
Okay, I feel as though my veterans representative out in this area has not really done anything to help me. I got out when I was 22, and by the time I was 28, I was deaf on my right-hand side. And all I hear is stifling, I guess, noise and beeping noises in my ear. And I sent in paperwork from Holyoke Hospital in Holyoke, Massachusetts, where I'm originally from. And when I went back, he said he didn't have the paperwork. So I got denied claims. So is there an alternative for me to go to somewhere else and go around him?
It's a really good question. Mr. Honeycutt, again, any assistance with helping this veteran for his claim?
Yeah, hi. I just a couple questions for you. What was the last claim that you filed and were denied on?
10 years ago.
Okay. I'll tell you what. Here's what we're going to do. We're going to get your contact information. I'm going to have one of our reps here reach out to you and call you directly. My feeling is you should probably file a new claim, especially.
Well, I just sent in a letter of intent because I just came off a cruise and I met some veteran representatives on the cruise, and they said, "Don't give up. Send a letter of intent."
Okay,
so
great.
A week and a half ago, I sent you a letter of intent to TOMA.
Okay, outstanding. So we will contact you, research that, get your claim information, and we'll start going from there.
All right. Thank you both. And again, we'll make sure that gets followed up. Again, thanks, Dwayne, for the rapid question and answers. You were definitely popular today. And we have Russ from Abbotsford, Wisconsin. Russ, you on the line?
Yes, I am.
All right. What's your question for us today, Russ?
Yes, thank you for letting me ask these questions. I have about three questions or three categories, I guess, and stuff. I am on blood pressure medicine and stuff, and I get my medication through the VA, but I have to take my INR every week. And why can't the Veteran Administration let us have home monitors and stuff to do it ourselves at home? Because I had to change insurance companies and stuff, and my previous insurance company give me a home monitor that I could do it. That way I don't have to run into the clinic all the time to get a blood test and stuff. I was wondering if it would be possible to get a home monitor through the VA. I was told that I have to go right direct to the VA clinic in Owen there every week or so to get it taken. So that would be nice if I could get a home monitor.
Russ, that's a great question. I think we're going to have to get back to you on that one to get some more details. Unless, actually, I think Dr. Clark might have a good answer here for you. 1 second.
Sir, I don't have a good answer for you right now, but I'll be in touch with you because I think that is a wonderful question. So many of our testing capabilities have changed over the last few years, so I'd like to work with you on this. Thank you.
Okay, appreciate that. Thank you. My next question is, I was wondering, I need eyeglasses, and I got a prescription from, through Community Care to go to a different eye doctor in Wausau, and I just got a new prescription through them, or eye exam, and that I was wondering can I get my glasses ordered through the VA clinic in Wausau? Do they handle that, or do I have to go down to Rapids, or where do I get them?
Thank you, Russ. My understanding is that, yes, you can get them filled through the Wausau Clinic. I will double check with our optometrist to ensure that I'm not giving you false information and get back to you.
You were speaking to the gentleman there from the Wausau Clinic that dermatology is available at the clinic now or not? Because I had called in about it before, and they said they did not have one, and I was wondering if that has changed or not.
Thank you for that question, Russ. We did have a dermatologist, and they moved to a different VA. So currently we do not have dermatology. We will continue to monitor our different needs within the clinic to see what specialties we will be bringing in the future, but that's correct. As of now, we do not have dermatology.
All right. Thank you, Russ, for the questions, and thanks everyone around the table for answering them. Again, it's a little bit hard to answer some of these more detailed questions without our computers, so we're doing this on the spot. And as a reminder, we got a slew of questions on the board, so please stick to just the primary one that you're asking. That way we can make sure all veterans are accommodated here. Next one is from Stephen from Nakusa. Stephen, do you have a question for us?
Hello.
Hello. What's your question for us on...
I was exposed to red lead and blue death and acetone and methyl ketones. I was in the Coast Guard, and I have Parkinson's disease. If I open the claim, would they reopen my past claims?
All right. Thanks, Stephen, for the question. It sounds like you got a question on eligibility. Mr. Honeycutt, are you able to assist with this?
Yeah, absolutely. If the question was, can you reopen your past claims? Without a doubt. And also, if you have not had the claim for Parkinson's, we want you to file it as soon as you can. So what I'd like you to do is, we will get your contact information, and I will have somebody from the regional office contact you directly.
All right. Thank you again, Mr. Honeycutt, for your assistance. We're quickly running out of time here, so we got Rebecca from Wausau. What's your question for us today?
Hi, I was wondering when the exams are going to start for the neurology, the re-exams.
What a great question, and we're going to turn it over to Dr. Clark.
Well, Trent, this is Karen. And so are you specifically talking about neurology or neurology comp and pen exams?
The neurology comp and pen exams, the ones where they sent the letter out and you had to contact them. So I was contacted already. I gave them all my information. I'm just wondering, are the appointments going to start soon or next year, or when are you going to start lining up appointments to recheck?
Yep, VBA actually has already been starting to schedule some of those appointments. So that should, we're not lagging and waiting another year. But I don't know if Dwayne has anything else to add with that.
Yeah, thanks, Karen. Yes, those rescheduling of those exams are in progress. Off the top of my head, I'm not sure where you are on the list. We can get some contact information from you. Can get sort of an idea and contact you. I'll have somebody reach out to you directly to see. Part of it has to do with the capacity, but we are going through the list right now and rescheduling those exams. So that's probably as clear as I can get to you right now.
All right. Thank you for that question, and again, thanks for the response. We have Kelly on the line from Tigerton. Kelly, what's your question today?
Hi, yes. With the community care, I was wondering if there's some way they could make it where it's not quite so complicated. For people that only have one or two, maybe it's fine, but like my husband has 4 or 5. So he gets approved for 6 months, and I have to keep track to make sure these don't run out. And then I have to get it approved, then make the appointment, let him know when the appointment is. Then when he goes to the appointment, then I have to let him know that he went to the appointment. And it really gets to be a lot.
It's a good question, Kelly. I'm going to turn that over to our community care expert, Mr. Johnson.
Hi, Ms. Kelly. I can completely understand and empathize, especially when you get multiple consults, like you said, for your husband. It's a lot to keep track of. It's a lot to stay on top of. One of the reasons for the calls is we have to touch base on every new consult. We have to touch base with the veteran and their caregiver on what their facility preference is. And we do that to ensure that the veterans have a choice in their care, where they want to be seen in the community. So we do continue to do that. We also can get that information from some of our community providers, but we are mandated to make those calls to make sure that yourself and your husband as the veteran is getting the care in the community where they need to.
All right. Great question, great follow-up response. It is 12:57, so that's all the time we have for questions this afternoon. If we did not get to your question, please stay on the line, because in just a moment, you'll have a chance to leave a voice note with your question, comment, or feedback, and then we'll collect all the unanswered questions, comments, and feedback and make sure that we post answers in the coming weeks. Again, thank you so much for joining us. This is your event, your Teletown Hall. We look forward to future Teletown Halls on the new topics and the upcoming futures, and we look forward to talking with you again soon.